Our team, the quality improvement team, are mostly made up of ex-practice nurses, so we wanted to do a particularly big welcome to our Practice Nurse Forum event and acknowledge all of the hard work that you do. We're going to present a few slides today on how our roles within WAFA can support you in your quality improvement work, showcasing some of the data reports available to you on our two tools, Primary Sense and the Primary Care Reporting Portal. Quality improvement, or QI coaching, is the process through which our team delivers support to primary care practices to improve health outcomes. We work with practice teams in a variety of ways, adapting to the practice and their QI needs. We provide tailored support, resources, and expertise, can help identify area for improvement and implement solutions, and use a data-driven approach to effectively drive quality improvement. We also help your team develop skills to tackle new QI initiatives, building capacity needed for creating and maintaining QI within your practice. We can promote a multidisciplinary team-based approach to QI, improve strategies for health promotion and screening, chronic condition management and prevention, workflows, processes, and can provide assistance in documenting and capturing your QI activities. Primary Sense is the first system I'll give you a quick glimpse of today, and apologies for the duplication if you already use this in your practice. Hopefully you might learn something new. Primary Sense is a population health management, clinical decision support, and data extraction tool designed for general practices. It provides real-time alerts, reports, and patient care prompts to help practice staff deliver the right care at the right time. It also provides healthcare professionals with on-demand reporting to help with population health management, proactive care planning, and quality improvement initiatives. Many of you have probably seen this on your practice computers, and I would strongly encourage you to have a play with some of the reports. See what kind of information you can generate and have a think about how you might be able to use it. You can't break it. We're also happy to come out to the practice to provide demonstrations. I'll go through a couple of the reports now quickly to share some ideas on how they might be applicable to quality improvement activities, but please do bear in mind that we can target these to your practice, patient population, staff interests, etc., to ensure that they're relevant by co-designing these activities with you. This one is a screenshot of the accreditation report. This displays percentages of baseline data looked at by the RACGP for accreditation, including recording of data on alcohol consumption, allergies, BMI, ethnicity, and smoking status. Running this report will enable you to compare your practice percentages to the RACGP minimum target and, if needed, implement QI activities such as inactivating patients and building patient data collection by the practice team to improve these figures. So you've run this report, identified a need to input data. Where do we find the patients to fix these reports? This is where the next report, patients booked in with missing PIP-QI measures with appointments in the next 2 weeks, is really complementary. This report identifies patients with missing measures that already have appointments booked in the 2-week period from the time the report is downloaded. We have lots of hints and tips about how to use these reports that we can show you face-to-face and how to filter to create a streamlined approach to addressing missing data. It can be customised well. The arrows at the top of each column allow you to sort the patients by relevance, alphabetically, chronologically, or from low to high or high to low. This report will highlight a patient with a missing measure by displaying its N in the relevant column or another description. Primary Sense is also an excellent tool to identify patients requiring chronic condition management, and our team recommend using the patient complexity reports for this. There are 2 versions of this report: patients with moderate complexity, level 3, and patients with high complexity, 4 and 5. The patient complexity levels given use the Johns Hopkins ACG tool, which is an evidence-based tool indicating the likelihood of hospitalisation and risk of poor health outcomes in a patient. A level 1 indicates a very low level of complexity with no known risks for poor health outcomes, whilst a level 5 is the highest complexity. A level 5 patient typically has significant multimorbidity and polypharmacy, and they're at the greatest risk of poor health outcomes. On the screen, we've provided a snippet of each of these complexity reports using demo patient data. And as you can see, the report has been updated to reflect the recent changes to chronic condition MBS item numbers. There are some slight differences between these reports, but both feature columns containing age, whether the patient identifies as Aboriginal or Torres Strait Islander, their hospitalisation risk, medical information, and what chronic condition-related MBS item numbers they have or have not been billed in your clinical software. Remember, the displayed information is based solely on your own data in your practice management software, so always double-check MBS eligibility via PROTA to ensure accuracy. Additionally, the data is only as good as what has been correctly coded in your practice software, demonstrating how important this is. Using these reports allows you to prioritise patients with advanced complex diseases and needs when offering services or implementing QI activities. This ensures that those who require the most attention and resources receive timely and appropriate care. This targeted strategy not only improves patient outcomes, but also optimises the use of healthcare resources, leading to a more efficient and effective healthcare delivery system. There are many more reports that can be utilised by your practice, and we're more than happy to demonstrate these to you on a one-to-one basis. But before we move on, I particularly wanted to draw your attention to one last report, which is a new one brought out to align with the launch of the National Lung Cancer Screening Program. Our immunisation and cancer screening team have lots of information on this program on their website, or it can be reached out to individually. But Primary Sense has taken all the hard work out of identifying patients who might be eligible for this. Running this report can allow you to send out targeted messages to patients who may be eligible, making them aware of the program and inviting them to discuss it with their GP. If you don't have Primary Sense at the moment and are interested in having it installed, please contact us. Our details will be available at the end of this presentation. Now, the other tool that WAFA have created is the Primary Care Reporting Portal, or PCRP. This has been designed to manage and provide timely, safe, secure, and reliable real-time access to your practice's data summaries. This tool has been released in 2 stages. Stage 1, where there's one nominated administrator with access for each practice, and Stage 2, which is coming soon, and will allow more than one PCRP user for each organisation. This is probably particularly relevant to practice nurses who would get a lot out of using this data. Access and approval for additional users managed by the nominated administration person or persons in this stage. I've got a couple of slides here to show you what kind of reports you can expect to find on the PCRP. This one looks at the patient demographics and is great for considering who your population actually are. In this example, for instance, there's a higher proportion of female patients aged 18 to 34 than any other group. So it might suggest that the practice has GPs with interests in fertility or obstetrics. This is the kind of thing we consider when suggesting QI activities that target the population of that practice. This report can also highlight some non-clinical QI that could be considered. For example, the need to archive some patients, looking at the active versus inactive pie chart, looking at offerings to DVA patients or patients in a residential aged care facility, or increasing ethnicity status recording. The next report looks at chronic conditions and mental health and the uptake of corresponding item numbers. Sometimes it can motivate a practice to reconsider their chronic disease or condition management processes for care planning. Down the right-hand side of the page, we can generate more specific reports detailing clinical measurements in patients with specific chronic conditions, which can inform targeted clinical quality improvement activities. The Cancer Screening and Health Assessments report gives the practice an indication of how many eligible patients they're capturing for cancer screening initiatives, tying into our immunisation and cancer screening team's work. This is another great quality improvement activity, and we often do this to link with a particular health promotion month or week, which can lead to lots of fun for a practice. These other 2 reports are looking at the ways in which a practice provides digital health-based appointments, such as the split between video telehealth and audio-only telephone appointments, and a similar breakdown of the accreditation measures as the primary sense report shown earlier. Really choosing which one you use is up to you. Now, as always, our dedicated team of quality improvement coaches are available to assist you in establishing and enhancing quality improvement in your practice. This was just a little snip of some of the tools that we would use and isn't specific to any one practice. We're more than happy to provide one-to-one support for your practice around identifying quality improvement activities based on your data. Please do reach out with the contact details on this slide.